All right. Well, welcome to another training. Today we're going to talk about dual eligible and really more than that because you really have to understand um, how any kind of extra help or additional help, I should say, kind of works with Medicare and the policies that you put them on and what kind of things are affected. So I will start out by saying anything that gives a reduction in cost that is provided by the federal or state government is probably, and I can't think of a way that this does not happen, but it probably generates a special election period. So when we're talking about extra help, when we're talking about partial Medicaid or full Medicaid or anything like that, all these people have special election periods. The only time that is not true is between October, November, December. Until they change that back to the way it was, you have 9 months of the year that you can enroll these people whenever they wish to put them onto a plan that has other benefits or possibly more benefits based on their situation. So we have a PowerPoint on this. Since I have kind of gone back to our website several times, I'm not going to do that today. I'm just going to pull up some stuff from the internet. So I'll share with you, and I just put a Google of Medicaid levels so you guys can see what you can find online, right? Before we get into this chart, and this is just an example, so don't take it as God's word or anything like that. um, there are different levels of help, right? So before we even get to this page, there is a federal benefit called extra help. Now, for those that are just coming on to Medicare, when they get their initial envelope from Social Security Department, they will get a little white card that says, do you want to sign up for Part A and Part B or both or whatever? Or it'll tell them that they're being signed up or whatever that card is going to say because it's different for different people. But there will also be a booklet in there with an application for extra help, ironically, right? So Social Security kind of pushes the idea that everybody should apply for extra help. Now, why is extra help not on this page that we're looking at here? Well, because it's a federal benefit and it only does two things. It puts people in the catastrophic level of their drug coverage. So we go back to our page 4 training that we recently did. They don't have costs for medicine, which is great, right? Takes away the costs for their premiums for their medicine as well. So catastrophic coverage, when you look in a book, if somebody only has extra help, they don't have any of the things that you see on the screen here. All of their co-pays and co-insurances or what happens inside of that booklet will still stay true, except inside of the drug coverage, you can tell them you don't have any cost for the drugs because you have extra help. And that will be realized when you go to see your pharmacy to pick up prescription drugs. So we can ignore this part of your summary of benefits because you have extra help. But extra help, just like what we're looking at here, has income thresholds for them to meet. The best thing I can tell you is if you want to enroll or help enroll one of your clients in extra help or help them get pointed in the right direction, you can always push them over to SSA, that's Sam Apple or Alpha .gov, and there will be a little spot. You might have to dig for it because sometimes they put it right in front and sometimes they hide it. But if you go down the rabbit hole, you will find an application for extra help. Or if you Google application for extra help Social Security, that will probably get you there quicker. But it is income based. You could probably find it if you Google it online what the current year's rates are. And it'll be broken down very similar to this. It'll be like individual monthly income or couple, but there'll also be asset limits. of what they can have. If you're looking at the same page I am, it's got Medicare Savings Program and all that stuff on there, that will have the same parameters as far as what they look for when it comes to extra help. Now, extra help is the easiest of all the things that I'm going to talk about today to get because, well, one, it's from the federal government, and two, it only assists with drug coverage. But like I said, if they do have extra help, then they don't pay anything for the drugs, which is kind of cool, right? So once I know what the extra help limit is for extra help, if I come across somebody and we're talking, we're going through page two and their income comes up and I feel like they're going to qualify for extra help, then I may assist them to enroll in the extra help program because that helps me. One, it gives me a special enrollment period that I can use. And two, what it does is it allows that person to enjoy the benefits of not having to pay for their drugs, or at least getting pushed into the catastrophic level of their drug coverage. We talked about the three different levels of how their drugs will work. So they don't have to worry about copay stage. They don't have to worry about the donut hole. They go right into the last stage, and they will be that way the whole year or until they lose extra help. So extra help is pretty easy to understand. It only affects drugs. It does give you an SEP, and it is a federal benefit. So that means that all states have the exact same requirements for extra help. Now we're going to talk about Medicaid. Some states don't even have Medicaid. Okay. A lot of states do. However, in general, they will be labeled the same as this example. Okay. And we're going to work from the bottom up. The bottom one, we don't really need to worry about because you're not going to come across that one very often. That is qualified, disabled, and working. Um, Most people on Medicare, if they have disability, um, they're probably under 65. They're allowed an income, but the income is so low that they're probably just going to say, I'm not going to bother working. So, in my experience, I think I might have come across one person with QDWI, but it is so rare that I'm just going to tell you to call me if you do come across an individual with that circumstance, because they will be in a whole different category than the other three that we're going to talk about. Um, so at the very top left of this, you see Medicare Savings Program, right? So I'll give you guys Florida as an example because Florida is pretty straightforward when it comes to what you can do. In Florida, you can actually become like a representative for people to be able to sign them up for some of these benefits. Other states may or may not allow that, just depends on where you're at. But in Florida, so for example, I can log into My Access Florida. I have my own login. I can apply for benefits for other people. And I can also check the status of where their application is. And if they are awarded one of these levels of Medicaid, I could actually be the first one to know about it because the letter that gets sent out to them goes into that portal before it even gets sent out to the client. So it's kind of neat. But it's all based off of what they call the Medicare Savings Program. So states that have Medicaid will also have a Medicare Savings Program. Most of the ones that allow you to apply for other people, that is the benefit that you're looking to apply for them. Now, I mentioned Florida because Florida also has about 8, maybe 9, maybe 10 other things that you can apply for, like SNAP and um, food stamps and all kinds of stuff, right? So, as an agent, the one that is most important to me is the Medicare Savings Program. Now, from my experience, um, to do your client the best as a Medicare agent, that would be the only program that you would look to point them toward if you're going to be the one signing them up. Um, because if you put anything else, let's just say it this way, the more programs that you sign them up for, um, the tighter the qualifications and the longer that application is going to take. So a Medicare Savings Program application could be done and back to that portal within 2 weeks, which means that if I work somebody at the beginning of the month, I could probably sign them up that same month for whatever they qualify for. And knowing what their income limits um, in your area are, or in their area are, can be to your benefit, right? So every state has their own thing. I'm not going to get into all of that because guess what? On our portal, we have all the different states and the programs that they have available. So depending on where you are, do a little digging inside of my research that I've already done for you, open up those things and um, see what programs are available. So if Medicaid is one of them, this is how it will break down. So again, starting from the bottom, the second from the bottom, QI1 or qualified individual. What that means is this person falls within a range of income where the state is going to pick up the premium for their Part B. So that 162, 171, one whatever they're paying is going to get picked up by the state that they live in. Okay. Now, technically, that's all that that does for the client. And as we go deeper into this, what I will say is if they qualify for this, they qualify for the one before that I spoke about. So, for example, as a QI1 or qualified individual, they will also qualify for extra help because the income requirement for QI1 is more stringent than it is for extra help. So if you come across somebody who falls within the income range for QI1, then you know they also are going to qualify for extra help, right? So as you're doing your presentations for them and speaking to them about their benefits, you can let them know, well, as a QI1, you'll also get extra help, which means that you don't have to pay anything for your medicines because you'll be in your catastrophic stage automatically. But QI1 technically, again, only pays for the Part B premium. It doesn't really qualify them for dual eligible plans. However, there are some areas that, and this is where you kind of really got to go into the summary of benefits with the dual eligible plans, where they will accept partial eligible clients to join these plans. Okay. Now, that could go one of two ways. It could be that they get the benefits as written in the plan. So if you pull up a summary of benefit, right, and that summary of benefit says this plan accepts all levels of Medicaid, partial and full, and there's no other small print to it. And it goes into the copay structure where they paid nothing to see their primary, nothing to see their specialist, nothing for hospital, et cetera, et cetera. Then you're good to go. You may find that a plan says that it accepts all levels of Medicaid. However, based on their level of Medicaid, they may or may not have a premium. Guess what? This person a QI1 will have that premium. And as you go into the plan, you may find verbiage that says something like this, 0 or $20 or 0 or 20%. So the partial Medicaid is the or person in plans like that. Okay. So I know that sounds a little tedious, right? So when I work with people and I realize that they're partial Medicaid, I'm very conscious about what the plans actually do. And I will not um, necessarily leave out the plans that are eligible for Medicaid, but I will realize myself that when I'm looking at the plans, they're probably going to enjoy benefits from a regular plan more than they're going to enjoy benefits from a dual eligible plan because dual eligible plans are generally built for full Medicaid. And so far, we haven't gotten there yet. Okay. Now, again, there are exceptions to this. You may want to look at some of the plans in your area and go into the summary of benefits. But in general, QI1, it pretty much just takes care of the Part B premium. Now, guess what? Just like the extra help, the QI1 also generates a Medicaid um, special election period, which is good from January all the way through September. So if you find somebody who's eligible for QI1 and they have it in place, they have an SEP. If they don't have it in place, then you point them in the right direction to get qualified to get their Medicaid. Now, what I want to do with this page is kind of break this down so you understand where some people have some shortfalls, right? So I have somebody who, let's say, makes it's a married couple, they make 1750 between the two of them, but they have $20,000 in the bank. Guess what? That person is not eligible for QI1 because of about $9,000 that they have in the bank, right? Now, a lot of us are financial advisors, right? So what do? We help our clients, right? And we find something to do with some of that money that's not going to show as an asset, okay? Um, and I'll kind of leave it at that because we all have our own thoughts on what we would do with that person. But keep in mind, they have asset limits, right? So when you're talking to somebody, it might be easy to say, okay, well, so what's your combined income? And you get excited because they say, well, I'm only making 1,800 between the two of us. And you're like, oh, got a QI1 here, right? SEP already ready to go. Let's talk about assets for a second. You have any money in the bank? Yeah. Is it about $11,000? Yeah. Shoot. Well, there goes that, right? Um, but not necessarily. So, QI1 normally, when they're doing their checks, will do a 3-month look back as well. So, into their bank. So, Medicaid will look into their bank and find out, what's going on with them. So that's QI1. So what should you take from what I just said? QI1 is a partial Medicaid. It has its own SEP. There's income limits, both for individual and if they're married, and it has an asset limit. What does it do? It takes care of their Part B premiums only, right? Unless you find a plan that says otherwise. And there are very few of those. Now, This this is where things get a little weird because different states will call things different things. So I pulled this one up specifically because it's generic in its terms. Slim B, or specified low income Medicare beneficiary, um, is also partial Medicaid. Okay, that's a different level, and you can see that the income level drops lower than what QI1 is, right? Most of the time, when you find a plan that allows for partial Medicaid, it's usually at the Slim B level, or the QMB level. But Slim B is usually the partial Medicaid version of that. Now, some states will have a Slim B plus. You're like, well, what the heck does that mean? um, I won't get into the really crazy details of how they separate Slim Bs and Slim Bs plus, but Slim B, if it has no plus behind it, is partial Medicaid. Slim B plus would be considered a full Medicaid. So if you live in somewhere like Florida, like Connie, Slim B plus would be considered a full Medicaid, where Slim B is still partial. So everything I said about QI1 would be considered true for the Slim B. If it's Slim B plus, then we're going to jump up to the QMB, and everything I'm talking about with QMB would be considered true for that individual. So Slim B and QI1 technically, for most people, can be viewed as the same thing, except there's different income requirements, right? What does it do? Pays Part B premium. That's pretty much all it does, unless you find a plan that says differently. Now, you might find a plan that says that this plan will pay uh, any premiums, co-insurances for people who have SLMB or um, QMB, right? Now, if you find a plan like that, then everything it says for the the cost structure will be true. Zero copay for doctors, zero copay for hospitalization, 00000, right? Where QI1 would probably still have a premium, and then they'll be the or person, right? So that's where the QI1 and the SLMB might separate in how they work with uh, the plan. But in general, what I have found is QMB, excuse me, SLMB and QI1 pretty much operate the same. Okay. Now, there will be some exceptions. Don't get me wrong. You will find those in summaries of benefits. So, what I recommend is when you find a plan that looks like it's going to be the right fit for somebody, go into the summary of benefits and look for that little area, be right at the front side of it. Who qualifies for this plan and how does it work? Right? Takes you 2 seconds of reading. But again, what does it do? Pays Part B premiums. Um, and then the restrictions are a little bit higher. And then finally, we have full Medicaid, right? Which is QMB. Now, some states are silly. They say QMB and then they have QMB plus, in which they have made QMB partial Medicaid and then QMB plus the full Medicaid. And I know I'm probably confusing the hell out of all of you right now because you're saying, well, wait a minute, on the sheet here it says QMB and I'm talking about full Medicaid, right? Some states have adopted some different terminology, and the way that they can qualify for these different levels of Medicaid is what determines if they're a plus or not a plus. And so I'm using my experience from the state of Florida to help you to realize that sometimes you need to double check with maybe a carrier or yeah, I would say probably one of the carriers to make sure if they're full or partial Medicaid. Because even though they're Slim B, If they're Slim B plus, they're considered full Medicaid. If they're QMB, in certain states, they may still be partial Medicaid. But if they're QMB plus, they're full. So now that I have confused you thoroughly, um, let me explain what full Medicaid does regardless. Okay, so taking away any plan or anything else, it pays for the Part B premium. It pays for any deductibles, co-insurances, co-payments. It pays for everything, right? So you might be saying to yourself, well, if I have somebody who's full Medicaid, or what this sheet would say is QMB, why would they want a Medicare plan? Well, keep in mind, this is only for medical, okay? Now, will they qualify for extra help? Yes, if they apply for it. So, all their drugs are covered. They don't have any copays or co-insurances for their medical stuff. Why would they want to join a plan? And a lot of your clients will ask you that. Well, I might pay $2 when I go to the doctor. Why would I need to go into a plan? Well, let's look at what the dual eligible plans offer. They're going to give you spending cards for things like rent, groceries. They're going to give you dental, vision, transportation to and from doctor's offices, the pharmacy, et cetera, right? They're going to give them a lot of benefits that they would not have if they just stayed on original Medicare, even though that they don't have any copays. They still won't have any copays, right? You're not going to move them to a plan that has $20 doctor visit fee, right? That's not how that works. What happens is the Medicare and the Medicaid work together. And because there's an overlap of funding for the medical, what the plans are allowed to do is give them additional benefits for things like the vision and the dental and the transportation and the card for this, that, and the other. So those are your three basic um, levels of Medicaid, and what they do. So what happens when you put somebody into a plan that is um, Medi-Medi, right? That's what they call those. Dual eligible plans are called Medi-Medi plans. So when you do that, then they're taking the assignment or the cost that Medicare would pay, and they're taking the cost or the money that Medicaid would pay, and they're getting that into a private insurance company. Let's say Humana, right? So all that money is going to Humana. And so Humana becomes the only company that they have to worry about. They don't have to worry about Medicare. They don't have to worry about Medicaid. Their only source of payer is Humana. Okay. If they stay on original Medicare is primary and Medicaid is secondary. So here's something that you might run into. You might run into a situation where you live in an area where your Medi-Medi plans are only HMOs, and somebody has to go to somewhere that, let's say a long-term or not a long-term, a care facility that only accepts straight Medicare. That's somebody you do not put on a Medi-Medi plan, right? Because they're not going to have copays because they have full Medicaid. Let them stay where they are. But they're also not paying for their drug plan. So instead of putting them on a Medi-Medi plan, which takes care of their medical and their drug, Just take care of the drug side of things, right? You still get paid for it. It's not as much, but you still get paid for it. And you're doing the right thing for the client. But if all the stars align and their doctors are covered or they're willing to move doctors if the case dictates that, then whatever insurance company that you put them with is going to be the only payer um, for their benefits. And that's because that company is getting paid by two different sources to be able to manage that client. Okay, so I know we only have a few people on here. I have probably confused the heck out of you guys, which is good. That means that there will be questions this week. So I'm going to stop training for a minute because we've kind of covered the meat and potatoes of this and open it up for questions because this really blows a lot of people's mind on how Medicaid works, but I want to make sure that we understand um, how this goes together with the plans. So Bridget says, could I repeat what I said about not putting them into a plan? Sure. So let's say that I am contracted, I'm brand new agent. I'm only contracted with Humana. And I meet with a client who is full Medicaid. They have been going to their doctor. The doctor says, hey, you got a $2 copay because of your Medicaid when you come to see me, but I'll even waive that. So you really don't have any copays. When you go to pick up your prescriptions, the state has already assigned you a drug plan, so you don't have to worry about prescription drug cost or premium. Um, Tell me what you got, right? Okay, so I'm doing page two, and we're talking about their doctors and things like that, where I happen to meet them uh, by friend, and they're coming out of the hospital, but they're going into a facility for rehab for 6 weeks, right? And that rehab facility only accepts straight Medicare. They don't take any plans, right? Especially plans that have anything to do with Medicaid. Well, it wouldn't be to their benefit for me to put them into Humana because now they're going to have to find a different facility to go to. They've already been set up to go to a specific facility, right? And that might have been a lot of work for the family to have been working with a doctor or the case manager or what have you. So when that period of time ends and they're back home and they're looking at getting doctors for whatever situation that brought them into the hospital or brought them into rehab, now might be a good time to put them into a Medi-Medi plan. This is why they have 9 months out of the year to sign up for a plan, right? Because they have different needs than your standard Medicare person, right? And they can't afford for mistakes to happen, right? They can't afford to pay out of pocket $130 a day for um, a specialty facility or what have you. So um, that would be an example of when you would not put them on a plan is when their doctors, again, like anything else, their doctors don't match and they're not willing to change or they don't want to change. Don't force a square peg into a round hole, right? They have 9 months. So if they get to a point where they're willing to change or their situation is not forcing them to go to somewhere that only accepts straight Medicare, then might be a better place to go. Now, on the flip side of that, I will say this. There's nothing wrong with you putting somebody who has full Medicaid on a regular plan, right? So let's say that you look up a plan that's, let's say, Humana, PPO, right? And they have full Medicaid. but it's not a Medi plan. It's just a regular plan. QMB says right there, helps cover deductibles, co-payments, and co-insurances, right? So, if you put them on that plan, they're still not going to have co-payments or co-insurances, right? So there's nothing wrong with putting them onto a PPO plan. Um, you're just going to have to explain to them that because they have two sources of payment that come in, that the booklet that you're reading is going to be a little bit off kilter, right? Um, and what I mean by that is when you look at the summary of benefits, you're going to see $20 copay for your primary, $55 copay for your specialist, 125 days per day in the hospital for up to 7 days. Um, those won't apply to you because you have full Medicaid, right? Um, and sometimes that's kind of one of those, what doesn't make sense to me? Well, um, you can bring them back to a page like this to help them to see what Medicaid does for them, right? And the rules don't change just because they go into a plan. So let me open it up for some questions because I feel like I have stopped at a good point to get some questions. And Connie, I see your question. We'll hit that in a little bit. But I'm trying to get some of you guys off your microphones. So ask me some questions.
I have one.
Okay.
Okay, so my guy, he was living at his son's. He went to the hospital. Then he was going to have to go to rehab, and then he is going into a not assisted living, skilled nursing. And the nursing home told the son that nursing homes are only going to take Part A and B Medicare because they pay more to be institutionalized. So we gave him a Part D prescription plan, but I do believe he is in the process of being certified with Medicaid. So is he the one who would be good for a QMB? Because the premiums,
Okay.
I just want to make sure
So
I'm doing right by him.
yeah, no. This is a really good question and probably the perfect forum for it. Okay, so when we talk about institutionalization, right,
Right.
there are plans that are available that we cannot sell for people who are going to be in an institution long term. So if you look at any summary of benefits, right, you're going to see that there is a period of time that um, and actually the cost is different for this period of time, right? But it's broken into two sections. There's a free period, usually about 3 weeks, and then there's a period from the 21st day on that has a copayment. I believe it ends at the 100th day, if I'm not mistaken. And after that, plans do not cover anything. Well, the reason for that is if you look at what original Medicare, if you go really deep into CMS, like
Right.
I have,
Right,
and
right,
see what Medicare covers, Medicare coverage stops covering at the 100th day. It's not hospitalization, right? It's skilled nursing. So on the 100th and first day, they have no coverage. That is going to be true for any plan that you put them on, except possibly, um, well, no, there's really no exceptions to that. Now, you bring up a point, right? So there are institutional plans. We can't sell those, so I don't address those very often because we don't have access to them, right? Um, there is another version of Medicaid that is specific to institutionalized patients, right? Now, this kind of Medicaid is built for people who are going to be not transient, which means that they're going to stay there pretty much until their end of days, right? That Medicaid is run differently. And really, what happens with that Medicaid is the state changes what they pay the client and reduces it until they only are getting paid, I think it's like $70 a month. But the federal government withholds everything else, gives it to the state that they're in lieu of payment for long-term care. Okay. Um, so that's a different kind of Medicaid. We have no way to help them sign up for that. That has to be done through the facility that they are going to be in, right? And I don't really wish that on many people. Both of my parents had to go through that process, and so I know it very good. Um, they literally take their entire check except for about 60 or $70, and that's really just for health and comfort items, right? But the rest of their money, according to Medicaid, is for their housing at that point. And so that covers their light bill, their housing, their nurse, their everything, right? And to be honest with you, people who will end up qualifying for that would not be able to afford long-term care regardless. So when you come across people like that, um, yes, you could do something with their drug coverage if you'd like to, change them into a different plan. They won't have a premium cost for that once they have their Medicaid in place. But you also might want to make sure that you're talking to the facility because some facilities use specific vendors for who they get their drugs from because usually people in that situation are not going to be very mobile. They're not going to go out to the pharmacy to get their drugs, right? They're going to have an in-house or delivered pharmacy, or they might do a mail order, but most of the time it's something where it's taken care of by the facility, and so they want specific vendors only, which means that they're probably only playing with the big boys, the United Healthcares, the Humanas, the Aetnas, Cignas, but not like Clover and some of the smaller
I think we
players.
chose Silver Script, which
And
is
that
what
probably
they,
would be a good one. Yeah. But you might want to just double check and make sure because some facilities have made agreements with what would be considered sister companies, like Optum, for example. Optum is a sister company to United, right? So SilverScripts doesn't always play well with Optum.
right.
So,
I did check with the facility and we both agreed that that was the best one.
okay, perfect,
Yeah.
perfect.
I got real involved, which is good.
Sometimes in those situations you have to. Yeah.
True.
What other questions do we have about dual eligible plans, Medicaid, extra help, any of that kind of stuff?
The extra help, can you go over the extra help wh where that comes from?
Sure. Can you guys see my blank web page? Well, not blank, but
Yes,
you can see prepare, apply, blah, blah, blah.
yes.
Yes. Okay.
Okay. So, I think this might be the right website.
Extra help.
No, didn't like that one. I hate when they change their websites. They used to make life so easy for me. Okay, so we're gonna have to dig on this one for a little bit.
Yeah, I was a little confused.
The search button. Oh, hey, here we go. Extra help. Oh, that's what it was. Medicare Part D extra help. Okay. So, see how I can apply online right there? That's pretty nice, especially if you have a client that falls within those parameters, right? So, what does that extra help do? Extra help, and this is going back to my page 4 training, right? Extra help puts them in the catastrophic coverage automatically. As soon as they gain extra help, they do not have whatever their plan says for their drug coverage. It is negated, and they fall into the catastrophic coverage of their drug coverage, right? So you can go right here. I'll be very nice to you guys today. I'm gonna put that in the chat.
Thank you.
I can find the chat. See what happens when you get 15 different windows open. Um, you can go to their website, help them apply, right? It takes like 5 minutes. It's really not a very long application. Um, and then if you have any questions, right, about this is my favorite website, Google. You can go Google and find almost anything you want to. So if you go to Google and you say, okay, so um, so let me give you guys a little bit of a side note here. You see the first thing that comes up, the second thing that comes up, those will bring you to competitor websites. eHealth, they're trying to sign you up. MedicareSolutions.com, trying to sign you up for a plan. Okay. .gov is where you have to go anytime. Anytime you have questions about Medicare, go to .gov websites, right? So, what is the Extra Help program? Dun, dun, dun. Okay, that's pretty cool. There's a link there. You can apply for extra help. That didn't really tell me what I wanted though. I'm not used to this Copilot thing, so let's go over here. Okay, so who gets extra help? If you go into it, it'll tell you what the different dollar figures are of all that fun stuff. But you see right up top here, what is extra help? It's a Medicare program to help people with limited income and resources pay for their Part B premiums, deductibles, co-insurances, and other costs, right? Will it cover the Part D penalty? Here's a cool thing. If you find somebody who's low income and said, you know what, I never signed up for a drug plan because I couldn't afford it. sign them up for extra help. And if they get it, it waives their penalty. They will not pay a Part D penalty. I can't tell you how many people I have signed up on Medicare plans because I got them extra help and then they don't have to pay their Part D penalty. Now I can put them on a standalone plan or a Medicare Advantage plan and they don't have the Part D penalty. I had a lady that was 88 years old. Do you know how many months of not having coverage that is? The penalty was ridiculous. We applied for extra help, got it. The next month she was on a Medicare Advantage plan and happy as a lark because she actually needed some medicine. She had been paying out of pocket for her medicines. Okay, so who should apply? Look at this. It's right here on the website. Guess what I'm going to do for you guys? I'll put this into the chat for you. These are um, your income limits, right? Now, remember the other one? It had like 4 different things. It was like a big schedule. You're either married or not, right? And so individual income limits, 22.5. A lot of people qualify for that, right? If you look at what people are getting paid for their Social Security, married couple, a lot of people will qualify for that as well, right? Now, keep in mind that is an annual income, right? There is a way you can go and deep dive into the internet and find what the monthly is, or you could just divide that by 12 and get that monthly number, right? But here's a cool thing. You see this right here? What counts in resource income limits for you financial advisors out there? See this stuff? Remember I said, hey, I've got money in the bank. Yeah, stay away from that. Okay. But what doesn't count is a burial expense policy, money for burial, a final expense policy. Sure is, right? Um, just saying, there's ways around some of the resource limits as long as you do it the right way, right? Now, should you help somebody apply for extra help? Well, if you know that they're on the verge and they may answer something incorrectly, for example, they've got $18,000 in the bank. When you go out to fill out the application, they are setting aside $1,500 for burial expenses. Okay. And then they qualify for extra help. So sometimes it's being smarter than the computer that you're working on in trying to get people your benefits, or the benefits that they probably need to have, right? I don't know about you, but I look at these income levels and I say, these people are already struggling a little bit, right? Just to make it day by day. So if there's anything I can do to help them, whether it be a plan, get them on extra help, get them Medicaid, because the Medicaid numbers are worse than this, right? Um, I want to do that because they're already struggling, right? And it's not necessarily their fault um, that they have that low of income. They may just, that's all that they get from Social Security, right? And they're not able to hold a full or a part-time job anymore. So these 2 websites that I gave you for extra help, really, really good stuff, right? There's nothing that says that you can't help them apply. Now, every state has a different way to do Medicaid, at least for the ones that have Medicaid, which are most states. So for that, I have to point you back to the LBA website where I have all the different states and all the different programs, not just Medicaid, not just extra help, but every program that's available in your state. So go back to our LBA website and look there. I have downloaded all the states that have Medicaid. So if there's a benefit to be had on the Medicaid side, again, the state level, we have it already archived there for you. And all you have to do is take a look at it, right? And a lot of times it'll tell you how to sign up. Most of those sheets are built pretty easy for you guys to be able to work through. So if you don't want to, don't have access to, or can't for whatever reason help them sign up, you can at least point them in the right direction. Extra help, I would almost always help them sign up because the application process is very, very simple. It'll take you less than 5 minutes. Okay. But you guys can see what the benefits are for doing that. And if nothing else, even if you're doing it for selfish reason, it gives you a special election period once they qualify for it. Right? So, good stuff. What other questions do we have so far? We are hitting right at 6:30, so I want to get as much as I can in before we close this training out. It always flies by, Connie.
I think it's a lot of information. I think we have to, every case seems to be different, and we have to just investigate and research and just take the basic knowledge that you gave us today. So thank you for that, because I think this is a big void in my knowledge bank. So
Mine
Gotcha.
too. Yeah.
Yeah,
And then
I'll
you can
say
always call
this.
Carl.
Thank you
Yeah,
so much for the training.
if you're used to doing financial management for folks, this is a whole different class of people, right? Probably people that you're not used to dealing with. But these are the people that need your help the most, right? And this is honest to goodness. And this is a good chunk of Medicare beneficiaries right here is what we talked about today. Now, the nice thing is, if they qualify for anything that we talked about today, and extra help is where it starts. That's the least stringent of the programs. Then they have 9 months to sign up for whatever plan or whatever you're going to do with them, right? So you have the most amount of time to work with these clients. You don't have to try to squeeze them in during OEP or AEP or disaster or whatever. These are people that you sit down, take a little bit of extra time with, you find out the right plan for them, and you sign them up. And it doesn't matter really what month it is, right? Except at the very end of the year. But these are the people that I think you'll find are the most easy to find this time of year. And if you do it right, will be the most loyal to you as a Medicare expert going forward. It is very uncommon for me to ever lose somebody who I spent the time with to get them extra help, to at least point them in the right direction to get their Medicaid, and then put them on a plan where they don't pay anything and they get a whole bunch of other benefits that they never had before, right? That person is going to be like, you know what? I'm staying with that dude because he knows how to help me, right? Where other people are just not going to do that. So don't take this training lightly. This is a very important one. And so if you missed something on this one, I do have a PowerPoint on this one. And I have the recording of this that will be available in just a couple of days.
I
Bridget, you have a question?
wanted to mention something, if I may.
Sure.
I had a T65 client, and she's a neighbor, and we became friends, and she definitely is showing loyalty, but she's getting confused by these people who are calling her, texting her, emailing her, saying that they're actually saying to her that they are her agent. I mean, they're going that far over the line saying that they are her agent. So she was very confused and very upset with me because she thought maybe I had given her away or something. We got it worked out, but I think that's just one thing to be to watch out for with the two T65 folks, because they do get very confused because there's so many people reaching out to them.
Yeah, that's a good point. When I go to an appointment, when I leave, I have made the sale, right? Um, and what I tell them is, look, every year you're going to get the same thing. You're going to get a stack of books this high, throw it all away, or throw it in your fireplace, whichever you prefer, right? You don't need any of it. You don't need anything from a WellCare, a United, a Cigna. If it has anything to do with Medicare, throw it away. You and I can sit down and look at any plan you want to, right? So don't burden yourself with that stuff. I know it's coming in the mail. It might come in the mail every single day. If you have a fireplace, save it up and burn it. Free firewood, right? But you don't need any of that. Now, here's the other thing. You're going to get text messages, you're going to get phone calls, you're going to get a whole bunch of stuff from people. Here's what I want you to do. I want you to save my cell phone number, this phone right here, and I give them my phone number, and I make them take my picture. And I said, if you don't see my face come up and they start talking about Medicare, tell them that you don't need to talk to them. You have an agent, because I won't call you from anything but this number. And that has worked for me for 20 plus years. Well, I haven't had picture phones for that long, but my phone number saying Carl Judd, insurance agent or whatever, has worked for that long. So yes, Connie, I totally agree. Forewarn them and say, look, basically don't talk to anybody unless it's me. And if I have something I need to call you about, I want you to have my cell phone number so that you know it's me. Okay. All right. We've got a couple of hands up in the air. I saw Bridget first, and then I saw Sarah Jane after that. And I think that's all that has your hands up.
So, short answer is fine, but if you can, on this, but say they fall off the Medicaid, what actually does that look like? And then how do we proceed from that?
Okay, somebody who loses Medicaid, first of all, that's a SEP, so they can sign up for whatever they need to at that point. If they're still eligible, push them back into the system, right? Have them reapply. A lot of times people will fall off because they didn't do their recertification, which is unfortunate. But yes, if they fall off, they have to go to a regular plan. They have an SEP to do that. Try to get them reapplied, right? If they still qualify. If they come into a situation where they've come into money, and now they don't qualify, well, good for them, right? I'm sorry that you've got to pay $20 copay for your doctor, but you got a $500,000 in the bank. My bad, right? But yeah, that's what that looks like, is you help them in whatever direction they need to go. But if they still meet all the requirements, then just say, look, here's what we need to do. We need to put you into a regular plan, because if we don't, and go back into the summary of benefits, look at the or part of that plan, right? Because chances are it's going to say you're going to pay 0 or 20% of that specialist copay. Normal specialist visit's $350. They don't want to pay $60 for that visit, right? Or whatever that turns out to be. But yeah, that's probably pretty bad. 20%, especially of diagnostics, they're not going to be happy. So it's kind of one of those, hey, let's hurry up and get you where you need to be. Let's get you reapplied for what you qualify for, and then we'll just make changes as your situation changes but I'm your agent, right? So that's what I'm here for. And in case um, I have not said this before, I don't say it a lot, but in case I haven't made this clear, the reason that we get paid, and this is probably it should be true for life insurance, right? But even more so for Medicare, we get paid basically a monthly stipend, right? Now sometimes you get the whole first year up front, right? But after the first year, you get paid monthly, and that's for a reason. You are their agent to care for their needs, whatever those needs may be. You may have clients that go years without having to do anything for them. You might have a client that jumps in and out of Medicaid, and you need to do something 3 months in a row for that client, right? But we do get paid to service them, right? Same thing with life insurance, right? Now, with life, we normally don't have to do a whole lot, but with Medicare, sometimes there's a couple of things that we do have to do. And did that answer your question, Bridget? Okay. All right. Sarah Jane, you have a question?
Yeah. Thank you for the training. Really
You're welcome.
appreciate it. So, for someone who has a Medicare Advantage plan Part D, how long are they covered under that plan?
So Medicare Advantage plans, if you read the fine print, they are good from January 1st until December 31st. Now, does that mean it ends December 31st? Usually not. Usually they're like rollover plans. They just
Mhm.
do the same thing, right? Or they'll get if there if and when there are changes, they will get a booklet, usually in the month of September, that's called an ANOC, an annual notice of change. So the plan that they are on currently, if there are changes for the following year and they do not move to a different plan, these are the changes that they will experience, right?
Mhm.
So why do I have to say it that way? Well, sometimes plans go away, sometimes there's new plans. Sometimes plans change the wrong thing and companies try to do slick stuff and and it and their plan actually ends. So for example, one of our agents came across a situation where um, they were trying to change the actual plan number from one year to the next. And that's a big no-no. You can't do that. You're actually putting people into a whole new plan, right? Um, so what they would do is they would have somebody from the company, and I won't name the company, but they would have somebody from the company call and say, "Hey, your plan next year will look like this. Do you agree to these terms?" Well, that's a little misleading, right? So I told them just go ahead and rewrite all those people, right? Um, and so that person came out pretty well because you can't just change the plan and say, this is your plan for next year, right? Now, if it has the same plan number, you get what they call an annual notice of change, right? But in general, most plans are good for 1 year and then they roll over to something very similar the next year. But any changes have to be annotated and sent to the client because when they sign for their plan, they're agreeing, just like a life insurance policy or any other policy, to the terms that you have presented to them. And that is 1 year at a time. So the signature is good and will revolve year to year with the annual notice of change, but the annual notice of change comes before the annual enrollment period purposely. So if they don't like those changes, they can go to a different plan. Does that answer your question?
Yeah.
Okay.
Thank you.
Okay. Any other questions before we wrap up? Because we're 14 minutes over. Okay. If you have more questions on the Medicaid stuff, I have done an earlier training where I dove a little deeper into the different levels you can go into. And then there is also, I believe it's still up there, a PowerPoint on the LBA website that also talks about Medicaid. So I encourage you guys to go check those out if you have any more questions about that. And if you guys come into any questions or situations where you need my assistance with that, feel free to reach out. Text is always best. So text me. Otherwise, let's see, this is May, June. Yeah, we'll have some training next week. I'm not sure what. Might go into chronic plans, but we'll see. And Connie reminded me to go back to her first question here. Florida clients are receiving letters about the state not paying their Part B premium. That would be because they didn't recertify. So they're losing their Medicaid because they did not recertify. So with Medicaid,
They didn't have Medicaid.
oh well, then it's an advertisement. Listen, I'm going to tell you, Medicare, when you have seen and done everything, you're going to look at the Medicare industry and see what people try to get away with and just shake your head like, I cannot believe people have the audacity to try to fool seniors the way that they do. It probably came in a trifold. It probably was a big letter that said,
It was a
state of
letter from
Florida is
Social
no longer,
Security.
right. And then at
So
the very bottom of that, there'll be an asterisk with print nobody can read that says this is an advertisement for eHealth or XYZ Medicare company for a solicitation or something, right? Very sneaky. I hate those people. So you'll see that a lot, but if they haven't had Medicaid, um, then how could they lose the state of Florida paying for it for them, right? But if you want to send me a picture of that,
I will.
and
I
and
will.
we can talk about it offline so we don't keep everybody on here. But to close this out, I will say this: there are a lot of advertising techniques that are, in my opinion, not very good that are used. So again, when I meet with somebody, my phone number goes in their phone, and I tell them very straightforward, if I do not call you, don't answer the phone. Now, if it's very important, guess what? They're going to leave a message for you. And then if you have a question, then you can call me and I'll get to the bottom of it for you, because I want to be the one person that you can at least trust in all the craziness that happens in Medicare. Okay. Again, another way to keep clients. All right, everybody. Connie, I'll look for your text, and everybody else, I'll see you guys on next week.